Hi, Barbara Wally here, orthopedic and sports certified physical therapist, here to talk to you about weighted vests. This one is a shout out to one of my friends who loves to wear a weighted vest, especially when she exercises, and she asked me to look into this and to get my perspective. So here we go. So just looking at a simple Google search of weighted vests, and you can Google with me exactly what it looks like when you Google weighted vests. They are aplenty. You can purchase them anywhere. They're pretty affordable, and there's not a whole lot other than how to buy a weighted vest. So I had to do a little bit of digging with this. So weighted vests, they started with military training and fitness in the 1970s and the 1980s. And in essence, at least from what Google tells me, the purpose of wearing a weighted vest is for extra resistance with exercise. Okay, that makes sense. It can increase the intensity of a workout, increasing your strength, increasing your endurance and your cardio capacity. And it can have various health benefits and increase your caloric burn. Now, trying to look into some research, what I found is that there may be some benefits to fitness and bone health. There's a highlighting of limitations and the potential risks, especially when looking at this research study with the National Institutes of Health in 2018. It's a pilot study, so that means it's one of the first studies. It's kind of a tester study with 37 participants, so that means it wasn't a very big study. And it was for those aged 65 to 79, and the recommendation, or what they were aiming for, was to use the vest for 6 to 10 hours a day. And this was in conjunction with dietary weight loss. Half of the people just did weight loss, half of the people did the weight loss efforts with dietary changes with the weighted vest. And they found that it was pretty feasible, it was pretty safe, especially for older people who were obese. And then looking at another study, which has actually not been completed, it's a clinical trial with bone health, trying to see if weighted vests will improve bone health, especially those with osteoporosis. That's for those aged 60 to 85 years old. They, in essence, did it for about a year and had about 150 participants, so it's a little bigger, but the results are not out yet. But you'll see a recurring theme here that the only two studies that I could find were on older adults. There are not a whole lot of recommendations in regards to using a weight vest. So most of the people that I see using them and those who are most interested are younger people. So just take it for what it is. But the general recommendations I could find was to go light, especially when you're starting out. You can add weight as you go and as your tolerance improves. You want to make sure it's comfortable. So I guess if you can try one on, or if you put one on that you bought online and don't like it, send it back. You can use it for walking or running errands. They recommend you don't wear one when being upside down. So especially with yoga, don't ask me why. And no twisting when you have it, I guess, because of the compression on your thoracic spine. They don't want you twisting with it on. And you can wear it for anywhere from 20 minutes to 10 hours. I mean, it suits you, however you want to wear it. But the risks, essentially, they recommend not to use one if you have chronic back pain. And I would 100% agree with this. If you've got back issues, especially issues with arthritis, stenosis, or a herniated disc, that extra compression or pressure through your back is not going to be good for your back. There are also recommendations not to use it for shoulder pain or for knee pain. And when you're considering about 80% of the population has low back pain, and also probably has shoulder and knee pain, it's basically ruling out most of the population. So just take it for what it is. But there is a thought that if you're using it as a training tool, say, for example, in the military or for activities that require a lot of weight on your back, say if you're going on an extended backpacking trip, that it may improve your performance, which makes a lot of sense to me. But a lot of the research, especially when it comes to bone health, because this takes us back to one of the research studies that I was talking about, you really need to be in weight bearing and you need to be doing weight training when you're in weight bearing. So the jury's still out to me why you would be looking at a weighted vest with bone health, most especially, but just one of the better studies that are out there. So a 20 to 30 minute walk with a weighted vest wouldn't really help you with bone density, but take it for what it is. Those are my recommendations and my thoughts on weighted vests. They aren't necessarily, there's not really a lot of research to say that they're bad for you. There's not a lot of research to say that they're good for you. Just use caution and common sense. So that's my recommendation. Just reach out to me if you would like any assistance or would like to schedule a session with me for physical therapy online. But other than that, I hope you have a wonderful day. Thank you.